We're in the Nurses Week. Is this a week of Nurses Week coming up, or is it?
Well, it was last week, our Nurses Week.
Okay,
Every
sorry.
year, there's a Nurses Day, Nurses Week every year.
Okay.
It was running from the 6th to the 12th
And
of May.
what exactly is it? What do they do for Nurses Week?
We just celebrate the profession of
Being a
nursing.
nurse.
Yes.
Okay.
Yes, yes.
Just like they have Family Week, they have.
Yeah, it's kind of a way of showing
Secretarial
that
Day.
we're proud of it, and
You should be,
Yes.
because you work hard for it and you have long hours, and just so people know, that it is a good thing
Yeah.
that you do that. What type of schooling is needed to become a nurse?
Me personally, after I graduated from high school, I went to college and to get my diploma, which was 3 years. I am presently working on my university degree for nursing.
Okay.
That's going to take me a few more years, but yes, I do want to get my Bachelor's of Science of Nursing.
Okay.
And so is Cynthia.
yeah. Well, I did my high school in 3 years, and now I've done a year of university, and I still got 1.5 more,
Wow,
and then
good.
I'm gonna have my bachelor degree.
Good for you guys. And where can you go with this type of schooling? Where's the farthest you can go with it?
Oh my God! Well, it depends what you want to do.
Okay, so
You can go all the way up to get your master's in nursing. You can, I know not in Quebec, but in...
Yeah, but it depends. Like if you want to be a boss, if you want to be a scientist,
all
if you
wanna
want to
be
be, it really depends on what you like the most.
Okay, I see.
Yeah.
There's also something new that started over the last few years called nurse practitioner. It's not recognized yet in Quebec, but it does allow some
Medical act to be done. Yeah.
yeah, medical acts that can be performed by nurses without the authorization directly from a doctor.
Really?
Yeah.
Oh, that's good.
Yeah.
And will it be offered here?
Yeah, well, there's already 5, I think, in Montreal that are starting this program. Yeah.
Okay.
Good.
Yeah, it's starting.
So
Oh, that's good then.
soon they will be
It'll
in
be
the real job. And
implicated. Yeah.
Right on. That's excellent. Is there any type of like once you're done your school and you've finished, do you have to maintain your, I don't know, is there exams that come about? Is there something that comes about every year that you have to maintain your license or your
Well, we got the
upgrading?
CPR.
Well,
every
after we
year.
graduate from nursing, we can't just go directly into the work field. We
Okay.
have to write a nursing provincial exam, I guess you would call it.
Okay.
I graduated in the province of Ontario, so I had to write the nursing exam
For Ontario.
for Ontario. And
Well, it's
Cynthia-
mostly the same thing in Quebec. Yeah.
yeah.
Now, when you wrote your exam in Ontario and you came here to Quebec, was there any differences in the what the requirements?
I
from
had to
Ontario?
go to Montreal and write a French language exam, a 4-part exam written.
In Montreal.
Yeah.
Wow.
I don't know if you have to do that. It's been quite a few years now. Well,
Quite a
I've been
few.
working 12 years now as a nurse.
Okay.
And 12 years ago, to come and work in Quebec after I had my nursing license in Ontario, I had to go and write a French exam.
Really?
Yeah.
So far away.
I don't think you have to go to Montreal anymore. I think you can have the
you probably
exams
can have it a year,
closer
yeah.
or...
Okay.
Yeah, I don't think it's necessary
They
to
probably
go that
weren't
far.
set up the way they are now.
Mhm.
Maybe.
Yeah,
Well, it
exactly.
changes every year. So
That's right.
Yeah.
Oh wow! So when you did it over there and you came over to work here into
Yeah.
Quebec, there was no different requirements other than your French exam.
Yeah, exactly.
Oh, that's
Yeah.
excellent to hear.
Yeah.
Is there, because we're in the province of Quebec, is there different licenses like Ontario, Quebec? Is it different, the license itself, being a nurse?
no, not really. It's mostly the same thing. You do the same job. It's just that it's in a different province.
Different province?
Yeah.
Okay. So there's no special license required for it. Well, that's pretty cool. All right, the biggest question that I'm sure everybody wants to hear, what is the role of a nurse?
Well, actually, there's multiple ones.
Yeah.
I'm sure.
Yes. I would say that the role of the nurse was to meet all of the needs of a patient. You know, somebody who was brought to the hospital, not just physical needs, their emotional needs, spiritual needs, whatever it takes to get this patient back to their optimum, maximum functioning self. In order to continue on with their activities of daily living at home, let them function independently.
And You know, as a role of a nurse, for both of you, you're both on shift work. I take it. I'm not sure if your days or not, but that's another thing because you're there on a shift work. You had to be pretty much on call for these people. How do you feel about that? How do you feel being there on call to the people that come in with a crisis or?
Well, I like it. I love being a nurse.
Okay.
I just love taking care of people. I love helping people. I like being there for them.
Right.
I just...
And it shows.
It's not a
It
task.
shows.
You don't look at it as a task because you love it, you know? You come in and you're kind of waiting for it sort of thing.
Yeah.
You know?
We're...
That's what you're expecting.
Oh, that's
You're coming in and you say, okay, what's going to happen tonight?
We don't hope for the worst,
No,
but
but-
sometimes we like big things to come in.
You know?
Because I'm sure your shift
Gets you going
too,
and-
gets
yeah,
you going.
yeah.
And everything.
Yeah.
Now that you both have studied and went into your career, do you have any regrets in studying into your career?
I don't.
The only regret
Maybe
that
my
I
friends.
have is not going directly into university. Because now I'm doing it now.
And it's harder.
It's harder now with, with my full-time job and kids and other commitments. And
That's right.
it's hard. I would recommend anyone who's going into the nursing profession go directly into university and do it now.
It's tough. I agree with you there. And
Yeah.
I mean, it's not the easiest thing going back to school. It's
It
a
gives you
wonderful
more
thing.
choices. You can
Yeah.
advance a lot further into your nursing profession with your degree.
I
Yeah.
believe you.
Yeah,
And you said you will be done your degree in a couple of years?
in a few years.
In
Yeah.
a few years.
Yeah, in a
Well,
few
when
years.
it's done, it'll be a good thing, and then you can say, hey, at least I went to this. And same with you. No matter where you go, at least you have something to back you up.
Yeah.
Yeah.
You just never know if you're going to be here in Temiskaming all your life, or if you ever have
Exactly.
to go somewhere.
It's a
Yeah.
big key for that.
And there's a great demand for nurses all
Yeah.
over in
There
Canada.
is, I-
So, oh
Mhm.
yeah.
And you hear about like all these things. You hear cutbacks and the government doing this and this, but yet the need is the
But
hospitals.
that's the thing in Temiskaming, it's not really touching us. It's mostly in the big cities, You're going to
Yeah.
see it really in the big cities, and
Right.
especially in the merge and everything like that.
Right.
But here, we're kind of lucky for that.
So far,
Yeah, yeah.
so good.
Do you guys have a union here?
Yes.
You do.
Yeah.
One union, or is there more than
For the nurses, there's
just one
Yeah.
union?
yeah.
Okay.
Yeah.
So that's a good thing then, I guess,
Mhm.
because you pay your union dues, and at least that kind of helps you out too. In a sense, for stability and things
Mhm.
going on. That's
Mhm.
that's kind of a good thing. There's different specialties in nurses. What kind of specialties are there?
Well, in Temiskaming, there's a lot.
Okay.
It starts from pediatrics, to diabetes, and
There are yeah, and there's people, well, my post is in the short-term unit. I take care of acute people who have like acute illnesses. There are people that, there are nurses that take care of people in a long-term facility,
Okay.
soins longue durée.
yeah,
Okay.
And
an emergency.
there's emergency, the outpatient clinic during
That's
the day.
where I work.
Okay.
Yeah.
Trauma.
There's a lot more. I mean,
You
other
see a
than
lot
just
of
our
everything,
center.
a bit of everything, and
There,
Okay.
you can go into all kinds of nursing. You can go into
What is
the
needed
maternal
more
newborn.
here?
You can go into critical care. You can go into coronary care. You can go into ICU.
There's a wide variety.
tons,
Okay,
tons,
that's
tons
really
of
good to
nursing.
go.
Home care.
Home
yeah, we
care,
forgot to mention
okay.
home care. Yeah, that's a big field as well.
Is that a separate schooling, home care as nursing?
well, they
is it
take
almost
the
in the same
bachelor
place?
degree for that. Yeah.
Okay.
Yeah.
Yeah. Or a certificate.
Yeah, a bachelor. Yeah.
Yeah.
Bachelor's
And I guess
certificate in home care.
CPR courses, stuff like that, that's mandatory? You have no choice to take all
We take
all-
that
Every
every
year,
year.
yeah,
We're
every year.
recertified every year in CPR.
Because they'll expire, and you...
Every
Well, it's
year.
just to,
Okay.
Yeah.
to make sure that you still know, because we don't use it every day.
That's right.
So it's just kind of a reminder, so it's a sort of a good thing.
A
It is a
refresher
good
every
thing.
year.
Yeah, it
Yeah.
is good, because your practices are no good to you if you can't do anything
Exactly.
with them. So that's really good. And I used to take the CPR courses. I had taken them for the little kids.
It's always useful.
And it
yeah.
was perfect. Like, never used it, but I mean, I always knew I had it. And it's a good thing to do. And I think, for here in Temiskaming, you just never know. So as for
Exactly.
you guys, it could be you, it could be somebody, and
Because
you
you
have-
see all kinds of cases here. Like, I mean, we don't
people
just
would be
see minor
surprised,
cuts
you know.
and
Oh yeah,
Because
they'd
we're a
be-
small town, they figure, oh, you know, everything.
It's not because we're a small town that there's
not big
big
things
case
that
can
happen.
happen.
Oh yeah, we've had multiple traumas. We've had, you know, big car accidents. We've had major heart attacks, strokes, major
Burns.
burns,
Major burns, right.
deaths, you name it.
Everything, and
yeah.
and it's a tough area to deal with because
And it
really,
changes because if you got a baby, it's not the same treatment as an older person. you know.
That's true too, you know, and people don't see it like you said because we're a small town. They figure it just doesn't happen, but what goes behind closed doors is
Yeah.
well, closed doors. I say that because it's it's a
And we
small
have our psychiatric
clinic.
patients. You know, people
Okay.
who are suicidal, people who are depressed, people that come in and have to stay in our we have a security room on our floor.
And I think that's pretty interesting. You want to talk about that security room? Like what exactly is in there so people,
Well, our security room is,
the outlets are blocked, right?
yeah, it's for people who are at risk of injuring themselves or others. We
Okay.
put people in there. It can be locked. It's depending on the severity of the patient. We have sometimes surveillance 24 hours a day of the patient, like one-on-one.
Okay.
In the room, we keep...
There's no wires and no,
everything
uh,
is locked in.
yeah.
The mirror is like covered in a
With
plastic.
a plastic.
There's no hooks for the curtains.
there's no
way-
garbage bags.
no
garbage bags.
You
Anything
can't
that
have-
could cause
that
some
can, that
type
can
of
hurt
damage.
itself. The outlets,
Okay.
the light switches are on the outside.
And I think there's not
there's
even
an
warm
observation
water.
window.
I think it's just cold water.
I'm not sure.
I think it's just cold water there.
Oh,
is.
because
No,
hot
so-
could burn.
Yeah,
Okay.
it would be very, very difficult if anybody tried to harm themselves that they
Right.
could do it in this room.
And the bed, is it a standard bed?
Yeah,
The
it's a
same?
regular
Yeah.
bed.
Well,
Okay.
that habitually when they're really, let's say, suicidal, there's somebody at the door to make sure that they're not going to hurt themselves.
Well,
Mhm.
that's
So-
kind of a.
And, you know, we have restraints and we've used them.
Mhm.
Yeah.
Well, there's no age. I mean, depression
No.
could hit anybody at
exactly.
any age, and it's needed. I think, like, you know,
Mhm.
for knowing that it's there, it's a good thing, and
Oh, yes.
you know, like you said,
And we've
you've
had
used it.
formation, training sessions on how to handle, you know, violent, difficult people like that,
Okay.
and hopefully more in the future.
And that's tough, I'm sure, because
Yeah.
you, when you hear about it and take the courses, but when you actually deal with it, it's, I'm sure it touches the heart.
And that's a
because-
whole different specialty in itself. Yeah.
Mhm. And being that everything is a confidential issue, you know, no matter who the person is or the case is, you still have to deal with that one-on-one. And does it ever bother you when you leave your shift, when you're done and you go home and something has happened?
People are asking you questions.
Yeah, and people are.
Happens all the
It
time.
does, eh?
Yeah, it
Do you have a
does.
hard time to deal with it? after?
I don't.
No.
You get a
And
kind of
people
blank
who know
here.
me well,
Yeah.
people who know me well know right from the get-go. Nobody even asks me questions anymore. I told them right from the start, you know, it's confidential.
They should.
What happens at the hospital
They
stays
should.
at the hospital, stays in their chart, stays with me, and stays between me and the patient, and that's as far as it goes. And it's not discussed.
I agree. And it
It's not
shouldn't be
discussed,
asked.
and it's illegal. You can't do that. You can lose your job over it.
Well, it's because you're jeopardizing the rights of someone's privacy.
exactly.
And you don't want to do that because
No.
It's
they put their
irrespectful.
faith in you and all of, I mean, whether they
It's
come
our
there
professional
for,
responsibility to keep it confidential, and that's
and it's
that's the way
important.
it is.
And
Yeah.
people should not pursue that to inquire why, how come, what for. You don't ask. You don't go that
If
way.
the
you close
person
the
wants
door.
to tell it to others, that's fine, but
Yeah.
It's not
we're
up
not
to
going to
you
be the
guys.
one that's going to start it and go say, oh, well, this
Yeah,
person
and even
was
if we
here.
get phone calls at the hospital, you know, well, how's Mr. So-and-so or Mrs. So-and-so doing? Well, you know, and if you're not family, you know, immediate family.
have the right to say-
We say, I'm sorry, you have to speak with the doctor, or you speak with a family member, or the patient, him
You're
or
protecting the
herself.
rights of the patient
Always.
as well. and
Always,
that's
always,
good.
always.
I think that's so important. And like you said, when you go home afterward, you deal with it, okay? How are you, Cynthia,
Yeah,
with
it's
that?
just the fact that you have to kind of empty your head. What happens at the hospital is in the hospital, and what happens at home is at home. You know, it's kind of two different places, and you got to make the middle in there.
Well, I know where you're going because we're in the same boat, my husband and I. Work is work and home is home. Oh, sometimes
Sometimes you need to talk. I know,
talk
but
about
I'm
the
gonna call,
jokes.
let's say, Tammy, or you know, I'm gonna call somebody else, or just go sit down with a doctor and
We
say,
vent
okay, I
a
had a
lot
hard time
amongst
with this
each other.
patient, and it was hard, you know, because sometimes when you see somebody, and especially in Temiskaming, it's a small place, so you know everybody.
everybody.
So when somebody, I don't know, dies or something, I'm
touches.
sorry, I just can't be just insensible. I just can't.
Insensitive.
No,
Yeah.
insensitive.
Yeah.
And like you said, you phone her, you phone
Yeah.
another nurse.
But I'm not gonna go, let's sit down with my boyfriend and say, okay, I had such a bad day, this person died. I'm not gonna go do that.
To a point. Like, I mean, I'm sure you can't bring it home, but I mean, if
Well,
sometimes
for
you
sure
have
that
to.
if something is really bothering me, I know I
just
might
say I
talk
had
with
a
him
bad
a
day.
bit, but I'm just not gonna tell him what happened, you know.
Okay.
I just gonna tell him I had a bad day and, you know, just take it
And
easy
it's-
on me.
And it's tough. It's really, really tough because, like
Yeah.
you said, you see it, you've been there, you've done what you could to make the best of
Yeah.
it. And then unfortunately, if something happens, it's not your fault.
Yeah.
Like, it isn't your fault. It never will be your fault.
And
I
even
mean,
if
it's
you
just-
saw 100 or 1,000 things like that, you just can't get the fact that it's still gonna hit you.
That's right. And not one case
Yeah.
is the same, so they'll hit you differently. It's not an easy job. Like, girls, I must
But
admit.
it's very gratifying.
Yes,
It's
it
gratifying.
is.
Well, that's
Yes.
a good thing because
Very.
it's not. I'm
Rewarding.
sure you
Very
have
rewarding.
things
Just,
coming
you know,
out
having
often.
people say, you know, I was in this center, I was at that hospital, I was in the big city, and you know, I just couldn't wait to come back to Temiskaming because the care is so good and you girls just take such good
Yeah,
care
it's
of us.
true.
And you know what I like seeing is in the contacts or, I don't know, wherever you see it. Thank you to the nurses.
Yes, it's
Thank you to
true.
the doctors. That is such a
Yeah.
wonderful gesture on the
We get a
on
lot of
the
cards
people,
and
and I
lots
think
of-
that's nice. You know,
Yeah.
because you're right. We're a small town, and the care
And
is
we
so much
spoil
more
our
different.
patients a
We
little
do.
bit.
But that's okay. That's okay.
Oh, I think it's great that we can do that
Yeah,
because
exactly.
it doesn't. You can't do that in the bigger centers.
No, you can't.
It's not the
It's
same.
run,
They
run,
don't have
run.
time.
No.
Honestly,
It's
like
not because they don't want.
I'm not saying you
Exactly.
guys have time, but it's just you're smaller. Whereas
Yeah.
them, it's huge, and they have like.
It's a little more impersonal, whereas this
Yeah.
where we have a little added personal
You're
touch
right.
to our
You're
care.
right, and it does
Yeah.
make a difference. And I mean, my compliments go out to all the nurses, even to the doctors. We
Yeah.
only have a few here in doctors, but I mean, people should be grateful and very patient and tolerant. I mean,
Mm-hmm.
it's only a clinic here, and sometimes it does take a little bit longer in the emergency
Yeah.
room, but they just have to understand that not one case is the same. One emergency might be more
More important
urgent
or
than the
longer,
other, you
yeah.
know?
Actually, the waiting time in our outpatient clinic is nil compared to larger centers.
Okay.
Oh yeah, they're triaged within the first.
30 minutes is like the longest.
Yeah, the longest you'll
Well,
wait
it
to
could
be
be
triaged by
longer.
the nurse.
Let's say if we have an ambulance and you know it's a big case and he has to have this and that for sure because we're alone.
That makes a difference. How do you feel about giving needles? Do you like giving needles?
No problem.
Oh. And you?
My first one was
Doesn't
very
bother me.
difficult
Oh, was it?
when I was a student.
Yeah.
Yes,
Well,
I
it's a
think
different thing, eh? You're not sure of
you're very
anything.
nervous your first time, but after you do it once, it's
It's a piece of cake.
no
I
sweat.
have a hard time with
no
needles.
sweat. We start IVs, we do everything.
Okay.
It's no
You
I
kind
have
of
a
get
hard time.
used to it, I think.
I mean, you do get used to it and whatnot, but I cringe before the needle's even in there, and I'm sure
Yeah.
I'm not helping the nurse, but I just cringe and I don't know.
I think
you
it's a
see the-
normal reaction.
Oh. And I think the toughest part is when you have children, you have to bring them up, and you're trying to be real tough, say,
Yeah.
everything will be
No
fine,
problem.
don't worry about it. Meanwhile, you're chicken little down and your stomach's turning yourself. I'm no good at it. And I had my son tell me, Mom, everything's fine. That's easier for you to say.